Now, for more on the coronavirus outbreak, and as we told you earlier, more than 7,000 people are stranded on 2 cruise ships, one in Japan, the other in Hong Kong.
Well, it comes as the global situation continues to develop, with more people testing positive for this coronavirus. Here in Singapore, there are now 28 confirmed cases, with several instances of local transmission. And a leading infectious diseases specialist joins us now.
Professor Leo Yee Sin is Executive Director of Singapore's National Centre for Infectious Diseases. Prof. Leo, thanks for joining us. Firstly, we know there are at least 2 clusters of infections here in Singapore. Can we expect more community spread?
Well, I think from the epidemiological angle, we need to make a few differentiation. One is what we call a limited transmissions, means that, we can actually trace back the origin of the case as well as the transmissions, and we know where the links are. When we talk about wider spread community transmissions, means that it is significant spread within the community, where most of the times we may not be able to link back as to where exactly the infections come from. So for instance, if we talk about the influenza infections, common flu, a lot of times we may not be able to trace back, in fact, where it first started or where these infected individuals got the infections. So that's the 2 distinctions we're looking at. Now, coming back to this novel coronavirus, we do know that the transmissions and the rate of speedity in terms of the number of cases, it does look like it is much more than the SARS episodes that we experienced in the year 2003. So overall, I think we cannot discount the fact that there will be community transmissions, but the important thing here is that we have to put in all efforts, that as well as a preventive measure and a countermeasures, whichever the situations we are prepared for.
Professor Leo, on the point of how this coronavirus spreads, the transmission that you mentioned just now, we've been told that it cannot happen with just casual contact. So how do you define casual contact? If a carrier walked past me and sneezed, perhaps, would there be a danger?
I think, first of all, I would say that we should all develop very good social etiquette in terms of how we cough and how we sneeze. If we need to sneeze, it's always good to cover the mouth, cover the nose, and a proper disposal of the tissues or the handkerchief that we use to cover our nose and mouth, and frequent hand washing. Now, this is personal responsibility. If we can all do that, then I think the risk of transmitting any viruses, not just novel coronavirus, it can be influenza virus, it can be common cold viruses, and that we can protect our environment as well as our community and keep everybody safe.
But Professor Leo, I mean, to the point of my question, if somebody who was a carrier of this novel coronavirus were to sneeze and I was standing beside them, would that pose a danger to me?
If this person decided that they will sneeze and cough right in front of your face and there is no washing, there is a distinct possibility. It's just like any of the respiratory viruses. I mean, you don't do that to one another. When you talk about casual contacts, the meanings could be that if I just walk past somebody along Orchard Road shopping area, that itself does not constitute a very close, prolonged contact time, and that carries very low risk of transmission.
So looking forward then, will there be sort of permanent damage to lungs for patients recovering from the illness? Or is it too soon to tell that sort of information?
Oh. Yeah, it's too early. It's too early for us to be very sure in terms of how our patients will, after recovery, how they will perform. But we hope for the best, that they will have full recovery.
Prof. Leo, will those who recover, do we know if they will develop, a natural immunity? Perhaps it's still too early to tell, but if this coronavirus were to behave in the way that other influenza viruses have behaved, would you get an immunity to the virus?
In general, for any of the virus, after the viral infections, when the body develops protective mechanism, there is immunity, you will be able to defend yourself against that particular strain of virus. Now, it's still too early for us to say whether this novel coronavirus will mutate quickly to evade the immunity. If it remains at the same form, at the same shape, at the same genoming, then in that case, then your covered individuals infected with that virus will have immunity against that particular virus.
We have seen that a 6-month-old is one of those infected, and we've heard cases of newborns as well being infected. Is someone more susceptible to this if they are young or if they are sort of poor of health? Who's most susceptible?
I think all of us are susceptible because this is a completely new virus where none of us ever met with this virus or have pre-existing immunity. And because this is completely new, I would say all of us, the entire population, is susceptible to this virus, from very young to the very old. The only difference is that from the current few cases that's being reported so far in terms of the children with infections, they tend to be much milder compared to the adult, especially the older adults. And there are cases of asymptomatic infections in the children that have been reported.
Okay, well, thank you very much for your time this evening. Professor Leo Yee Sin, Executive Director of Singapore's National Centre for Infectious Diseases.